Hey everybody, my name is Dan Tenorio, and today I'll be talking about the etiology for Bordetella pertussis. So the way I set up my presentation is I'm going to categorize it into 4 sections because it can entail several things. So first of all, we'll be talking about the main etiological factors. Second of all, we'll go into the unique features. Third of all, we'll talk about how it infects its host. And fourth of all, we'll talk about the virulence factors. So first of all, the main etiological factors for Bordetella pertussis. So it's a pathogen, so it can infect the host. Its morphology is Cocobacillus or Cocobacillum, and it's part of the Bordetella genus. Its type of gram stain is gram-negative, so we know that under a microscope this will look pinkish or reddish, and we know that it will have an outer layer membrane. We know that it will have the LPS factor, which we know is a toxin, and it will operate under aerobic conditions, so that just means that it needs oxygen. And Bordetella pertussis as an infectious agent will cause the disease we know as pertussis or whooping cough, which is its most common name. Second of all, the unique features. So one of its unique features is that it's an encapsulated bacterium. And so we know that a capsule, among some other things, will provide protection. It's non-motile, even though there's another one in its genus, the Bordetella genus, that is motile. We know that it has fimbriae, which are finger-like projections that adhere to other bacteria or animal cells that contribute to the virulence. And we'll get into virulence later. We also know that it's pleomorphic, which is the ability for this particular bacterium to alter its shape or size in response to environmental stimuli. Third of all, let's talk about how Bordetella pertussis infects its host. So we won't talk about the reservoir or details specifically about the host. We'll just talk about how it operates once it's inside it, or the main parts. So Bordetella pertussis attaches to the cilia of the host's upper respiratory system. If we can recall, cilia are those tiny hair-like extensions that can be found in several epithelium cells, which we know epithelium is the outer layer of tissue of several types of organisms. Bordetella pertussis will then release toxins or poison which damage the ciliated respiratory epithelium of the host. It thereby causes the airways of the host to swell, and the bacteria will multiply once it's inside the respiratory epithelium of the host. So last but not least, let's talk about the virulence factors. So virulence, its meaning is that it's just the capacity to invade and harm a host, which will of course be directly correlated to its ability to cause a disease. And so the virulence factors for Bordetella pertussis include the pertussis toxin, the hemagglutinin, the protactin, the tracheal cytotoxin, as well as some other ones. So pertussis toxin is an exotoxin, which we know are both found in gram-positive and gram-negative bacteria. And so pertussis toxin sets the foundation for the infection, and it's also involved in the colonization of the respiratory tract. And one of its main functions is adherence. The other factor is hemagglutinin, which is a filamented protein that also binds to the ciliated epithelial cells of the host. The other factor is protactin, which is an outer membrane protein that promotes adhesions to the tracheal epithelial cells in the host. And the tracheal cytotoxin, it's an adjuvant molecule which can alter the immune system of the host. And in this way, the way it inhibits its immune system is by altering or inhibiting the DNA synthesis of the ciliated epithelial cells. Other factors include the adenylate cyclase hemolysin and the monocrotic toxin, which we won't really get into. But that's the main factors of etiology.
Hi everyone, my name is Emma Spurlock and I'm going to be speaking first on the reservoir for pertussis, and following that I will be speaking about the prevention and control for this disease. So first, what is a reservoir? A reservoir is where the disease can be found. For pertussis, the only reservoir are humans. Or in other terms, humans are the only species that can be infected with pertussis bacterium called Bordetella pertussis. Because of this, the prevention and control can be very simple as long as everyone cooperates. Vaccination is the most effective prevention for pertussis. Though it does not guarantee 100% immunity, someone who has been vaccinated can still get pertussis, but will likely be less severe of a case. Pregnant women are also advised to get the pertussis vaccination during every pregnancy so that antibodies start being passed to the fetus before birth. The hope being that if the infant contracts pertussis before his or her vaccination, that the case will not be as severe since pertussis can be deadly to infants. Controlling the disease is not as simple. When someone is infected, they may not show signs and symptoms at first, but they are still contagious and can pass it off to other people. So it is important to cover your mouth when coughing and sneezing and always wash your hands. Antibiotics are also available for control as it shortens the time that you would be contagious. It is best to be diagnosed as early as possible to be able to control the disease and avoid outbreaks.
Hi, my name is Casey Bluth, and I will be sharing the signs and symptoms as well as the different treatment options for pertussis. There are 3 stages to the disease. Stage 1, or the catarrhal stage, is commonly mistaken for the cold. During this time, the patient will have many of the same symptoms as the common cold, such as fever, cough, runny nose, irritability, and a decreased appetite. These symptoms typically start to develop about a week after exposure to the bacteria. During this time, the patient is highly contagious. This is problematic as the far majority of people do not know that they have pertussis during this stage. The second stage is called the paroxysmal stage. This is the stage that most people are familiar with and is where pertussis gets the common name of whooping cough. Most patients will have several severe, short, rapid coughs that are followed by a whoop or stridor. While most patients will have the telltale stridor, not all people will have it, especially infants who may not cough at all. You may see them struggling to breathe or even stop breathing. They also will gag. Some of the other common symptoms may be weight loss, dehydration, hypoxia, vomiting from coughing so hard, and epistaxis, which are nosebleeds. The stage regularly lasts from 3 to 10 weeks and can last even longer. In fact, in China, pertussis is often known as the 100-day cough due to the possible extended symptomatic period. In this slide, we see a young boy that is currently in stage 2. Note the classic whoop or stridor after he coughs, as well as the extreme fatigue that he is experiencing. The last stage is the convalescent or recovery stage. Recovery is slow and gradual, with the cough diminishing over time. During this time, it is possible for the cough to come back after it seems to have subsided, but it typically is not as intense if it does return. While the patient is no longer contagious at this stage, they do remain susceptible to any other respiratory infection or illness. In order for treatment to be as effective as possible, it must be caught during the catarrhal stage of the disease. If the patient is given antibiotics early on, It can help slow the progression of the disease and ease some of the symptoms. Treatment for infants and small children is far more involved. They do require hospitalization roughly 50% of the time due to their higher vulnerability and increased danger. In the majority of cases, adults and adolescents are able to receive treatment at home as long as they stay on top of nutrition, hydration, and receive adequate rest. Over-the-counter cough medicine is not effective in controlling the cough that is present, and as such, it is discouraged.
Hi, my name is Tiffany Becerra, and I will be talking about the mode of transmission for pertussis. The mode of transmission for pertussis is from person to person, as we know that we are the only hosts. It can be spread through airborne droplets or from direct contact with mucus from the nose or throat. We see this happen a lot with babies if the mother or family member are not vaccinated and become infected with pertussis. It can be easily spread to the baby through sneezing, coughing, or kissing on the mouth. That goes the same as well for adults. Anyone who isn't vaccinated, those are some of the ways that the disease can be passed to them. Transmission can also happen through a person who is asymptomatic. The infected person doesn't know that, that they have pertussis and may spend some time around babies or someone who isn't vaccinated, and therefore unknowingly passes the disease on to them. So here are a few additional facts about pertussis. The first one is sometimes the coughing fits can be so extreme with pertussis that they can actually crack ribs. Also, as we heard before about vaccinations, it's important with pregnant women, but did you know that they need to be vaccinated during each pregnancy, as those antibodies will help each of the babies as they're growing? And the last one here is that 80% of infants that contract whooping cough are actually infected by a family member or someone else in their household. And this is why it's so important for the whole family to be vaccinated before a new baby comes home.